How's that, everybody? Is that better? Sometimes we're trying to join in for the to improve the sound and things with technology, and it just doesn't work. Is that better? Give me a thumbs up if that's better. Thumbs up. It's better. It's better. No more static. All right. Well, let me start all over again then. I'm Dr. Nicole. You all know who I am. Board certified family physician. I help, and thank you. Thumbs up. I help. Good. I help people live their best lives. All right, let's start all over again. I'm Dr. Nicole, your board certified family physician. I specialize in treating and preventing chronic conditions and educating people about those conditions in terms that they can understand. Thanks for joining me today on my weekly Talk with the Doc session. We're going to talk about insect bites, okay? So I was showing you pictures of what one little itty bitty little ant did to me yesterday, okay? So I was swollen. That's my poor little foot. I was swollen like crazy. Thank you, Dr. Pam, much better. And there's a comparison what my regular foot looks like and then what it did to my poor little foot there. All right, so one little insect bite was able to do that. So you say, how does one little insect change beauty into a beast? That's what we're going to talk about today. So we're going to talk about a couple of different insects and their bites and what they can do to you and what you need to do to prevent these insect bites and how to treat the insect bites, okay? So let's first start talking about ants, because that's what bit me yesterday. It was not a red ant. There are different types of ants. There's red ants. Those are what we know as fire ants. There are the carpenter ants. There are just the everyday ants. Now, I'm not exactly sure what bit me yesterday. It was a black ant. I did see the ant when it bit me, but I don't know if it was a carpenter ant or just a regular, but I just know that it was a black ant that bit me. It wasn't a red fire ant. What happened was I was sitting there at the picnic. I felt like something burn, like sting me on my foot. I looked down, there's a little ant on my foot. I brushed it off. Now, like I said, this happened to me last year. So I was like, oh Lord, is this going to happen again like it did last year? But you know, immediately I didn't feel anything right away. But after about 5 minutes, my foot started itching really good. So I'm trying not to scratch. Next thing you know, my arms start itching. I'm like, oh Lord, trying not to scratch there. My arms are itching. My face started itching. So I'm like, oh my God, it's happening again. So then my heart rate went up. My heart rate was beating fast, pounding actually. I was up to 116 beats per minute. On my good little Apple Watch was able to clock me at 116 beats per minute. I got a little bit, hey, Dr. Dre, thanks for joining in. I got a little bit short of breath. My heart was racing. I started sweating. So I was having another systemic reaction to these ant bites. So I found, hey, Dr. Sam, thanks for joining in. I went and I called my sister and I said, another ant bit me. Can you bring me some Benadryl or something? Like I said, I was at the park. So my sister came and brought me some Benadryl. I took a Benadryl and, because I'm still, like, by this time, I'm like scratching everywhere. I'm like, oh my God, something's got to give. My hair was itching. My face was itching. I was starting to swell. My foot was starting to swell. I had to, hey, Dr. Cree, how are you? Thanks for joining in. Please share, everybody. Sharing is caring. So I had to take my anklets off because I started to swell like everywhere. So what happens when an insect bites you is that well, if it's a venomous, hey Renata, thanks for joining in. If it's a venomous insect, their venom goes into your bloodstream and it goes through your whole body. So sometimes it just affects that one system or that area where your foot is or where your arm or wherever it bit you. But then other times it will go through your whole body and it affects your whole body. Now, what I probably should have done, because I was feeling short of breath and I was having heart racing, but I wasn't having chest pain, but I was having heart racing. I probably should have called EMS at that point. I don't carry an EpiPen, but I probably need to start because this is the second time this has happened. Same reaction each time. So I think I'm allergic to these ants. But I probably should have called EMS. So when something bites you, the first thing you need to do, stay calm. But if you're having a systemic reaction, you need to get an antihistamine. So Benadryl is a great antihistamine. Hey, Cousin Phyllis, thanks for joining in. Please share this video. You want to get an antihistamine. You want to stay calm. If you are having a systemic reaction, if you're having chest pains or shortness of breath, swelling anywhere of your face, hey, Jonathan, thanks for joining in and thanks for sharing. You want to call EMS, like immediately, because this can be a life-threatening emergency. Thankfully, mine did not, my bite did not cause me to have any trouble breathing. I was, like I said, a little short of breath. I think that's because my heart rate was going so fast, but I probably should have called EMS. I'm asking you, if this happens to you, something bites you, you get short of breath, your heart rate goes up, you're getting any chest pain, you're getting any swelling on your face, like I had, and I'll show you that picture one more time of the swelling on my face. It was horrible, y'all. The swelling on my face. If you get that, please call EMS immediately, because this can turn into something not good. Hey, Dr. Melva, how are you? Hey there, Dr. Gail, how are you? So you want to call EMS if that happens, because you're having what's called a systemic reaction. When you have a systemic reaction, that means that venom or the insect bite is going through your whole system, okay? And it can shut down your respiratory system. It can it can affect your cardiovascular system. It can affect your whole body, okay? So after I got some Benadryl in me, of course, the Benadryl kicked in and I got very, very sleepy. And that's why when I started this video, I told you I slept for a long time last night. Probably got about 10 good hours in, which I probably needed, so that was a good thing. But you got to get that antihistamine in you. So I was also still itching, like, oh my God, I can't stop scratching. Well, you don't want to scratch. That's rule number one, don't scratch, okay? So you want to do things to try and lower, to try and treat the itching, the scratching. So take a cool shower. Not a really hot shower, because a hot shower can actually dry out your skin even more, and then you'll be itching even more. So you want to take a cool shower. Sometimes people also try and take an oatmeal bath. There are some products by places like, there are some skin products that are made that make oatmeal baths, and you can put that in the bathtub. That can help to just soothe your skin. The problem, though, with when you're having a systemic reaction to an ant bite, hey there, Faye, thanks for joining in. Please share. When you're having a systemic reaction, is that you're almost itching from the inside. So it's not something that's really on the outside of your skin, so that no amount of scratching. Yeah, exactly, Dr. Sam. Aveeno is a great one. They make a great oatmeal bath. You soak in that. And if you can't get an oatmeal bath from Aveeno, you can actually get some raw oats or some oatmeal. Actually put that in the bathtub and sit in that with a little Epsom salts, a little oatmeal flakes, and help to just take some of that, that histamine reaction, brings that down in your skin. Like I said, you've already taken your antihistamine as well, your Benadryl, your Claritin, your Zyrtec, your Allegra, something to block that antihistamine, block that histamine reaction that's going on in your body. Oh, thank you, Cousin Phyllis. Hey there, Ayin or David, whichever one of you just joined in. Thanks for joining in. So, what else do you want to do? You want to get, if you are itching somewhere, such as when I had the bite yesterday, I got like a little welt on my foot where it bit me. So I got some topical, what do you call it, calamine lotion, and rubbed that in to help. I'm not scratching now. I'm scratching now. But that's not from the ant bite. Hey, Eni, how are you? Good to hear from you. So you want to use some calamine lotion or something topical to soothe the area. Another great topical, hey, Dr. Portia, thanks for joining in. Another great topical product that you can use is aloe. So aloe gel, aloe vera. I remember back when my grandma was living, she used to keep an aloe vera plant. I probably need to get one just to honor her memory and to keep it around the house because it's a great product. But you break off a little piece of the aloe plant and the aloe goo that's in it, it soothes everything, cuts, burns, bites, everything. So get a little bit of that little aloe gel, rub that on the area, that helps to soothe as well. Hey there, Harold, thanks for joining in. Well, thank you. It's good to see you too. Hopefully we'll see each other soon. So you want to soothe the area. So soothing, what's going to soothe? The cool shower or the cool bath, the aloe, what else is it? The Benadryl oil or Benadryl cream, And then the calamine lotion, that helps to, yes, ice pack, yes, because you want to cool down the area. So where the bite is occurring, you do want to cool it down. You don't want to put direct ice directly on it, but if you get something cool, maybe wrap it in a towel, then you put that on. Hey, Dr. Tony, thanks for joining in. So you want to put something cool on that area. Hey, Tasha, how are you? Thanks for joining in. So, so you've taken your antihistamine now. You have taken your cool shower or oatmeal bath. You have put on your topical soothing ointments, and then you want to get some kind of anti-inflammatory, okay? Because, hey there, Superior, thanks for joining in. These bites hurt. They hurt really bad, okay? And that, they can hurt pretty bad. I'm still actually aching today. Yeah, it's still hurting. It hurts to bend my foot. It hurts to put pressure on my foot. It hurts. So, anti-inflammatory. So that could be Tylenol. If you don't have any problems with your liver, it can also be Motrin or Aleve if you don't have any problems with your kidneys, or you can take an aspirin because you want to bring down the inflammation that comes from the bite. Okay, so what are the kind of the different things that can bite you? There are ants, of course, which bit me, and those little buggers can bite. I'm just be honest. I'm a northern girl. I was born and raised in Seattle, Garfield High School, GHS. Give it up, give it up. We never had biting ants when I lived up in Seattle. Okay. Hey, Lanisha, thanks for joining in. Yes, I know the compartment. Yeah, the swelling is it's no joke, Dr. Tony. So we never had ants up in Seattle, not ants that would bite you per se. At least I never dealt with any. And I lived there for 17 years, okay? And I don't like wearing shoes. I'll be the first one to admit. I would love to run barefoot. I ran barefoot all the time. Exactly. Ants can bite. I did not learn that until I moved to the South. So now here I am living in South Carolina. Honestly, I've been here for 10 years. And I didn't even know that the ants could bite when I got here either. But yeah, Natasha, yeah, GHS, go Bulldogs, go Bulldogs. So I didn't know ants could bite. I've been here 10 years, and last year was the first time an ant ever bit me. And I was like, are you kidding me? Now I've heard that red ants can bite. You know, they say, oh, when you see the big red ant heels, don't go near the red ant heels. This was not a red ant. This was just a regular old little black ant. And that sucker bit me. Yes, ants can bite. Ants can bite, okay? So what are the ways that we can prevent ant bites? Well, first of all, if you know you're going to be outdoors, don't do like me and be in flip-flops or be barefoot. If you're going to a picnic and you're going to be in the grass or in the someplace outdoors, have on socks and shoes, okay? A pair of tennis shoes where the ants can't bite you, because that's a great way to prevent the bites, the ant bites, okay? Hey, Miss Maria, how are you? Thanks for joining in. You don't want these to bite you. Also, if you know you're going to be outdoors, use your products. Use your bug spray, okay? And I did not spray myself down yesterday. That was my fault. I always spray the kids, but I didn't spray myself. So get your bug spray, your DEET. That's a great product to use. Keeps the bugs away. And we'll talk about mosquitoes in a second here too. But DEET, bug spray, and then be covered. I know here in South Carolina, it was 95, 96 degrees yesterday. You don't want to always have on, you know, I like to have my skin out, but just be honest. But you need to be covered. If you're going to be outdoors, of course you want to wear your hat, sun protection, but you also want to have your arms covered, maybe a cool shirt, something that's breathable. Are there natural bug sprays? There are natural bug sprays. Yes, Skin So Soft also works. Skin So Soft is actually more natural than the DEET, and so Skin So Soft might work. I know that there are some other companies. I know, like what's the one? Mary Kay. I think they do Skin So Soft, but they make a great bug spray as well. Yes, Skin So Soft, and it smells good too. And the bugs are not attracted to the smell. Oddly, they're repelled by it. So Skin So Soft works great, and it's more natural than like the DEET. DEET can be kind of strong. Off is another great one, and Off actually has different brands. So you can get like an unscented Off, and then there's ones that are more for sensitive skin, the Off brand. So yes, Off is a good one. Skin So Soft is another good one. And I will talk with my naturopathic buddy, Dr. Sam, and I'll ask her if she knows of any more natural bug sprays that she can either post here or that get me a list, and I will put them up in the group, put them on this post. All right. So wear your bug repellents, wear your bug sprays, wear long sleeves if you can, and then wear socks and shoes. Okay. The ants can't bite you if you have on socks and shoes. All right. So what are some other things that can bite you? Of course, ants can bite you. Mosquitoes can bite you. And mosquitoes are carrying all kind of nasty stuff. So West Nile virus and the Zika virus and all these nasty things. So you really, really want to have your mosquito spray if you're going to be outdoors. Okay. It's the end of the summer. Everyone's wanting to enjoy the outdoors right before we go back to school or before we go back to work while we're on vacation. Please cover up and put on your bug spray. All right. So we want to prevent those mosquito bites. We want to prevent the ant bites. What are some of the other things that can bite you? Burt's Bees and Badger are natural bug repellents. Okay, great. Dr. Pam says Burt's Bees, which I know have some great products in general. I've never tried their bug repellents, but maybe I'll have to go get some because I need some bug repellent down here in the South. Okay. What else can bite you? A bee doesn't bite you, but a bee can sting you. So you know that there's different kinds of bees. There are just your regular old honeybee. A honeybee. Hey there, Marsha and Tanya. Thanks for joining in. You got your honeybees, and when they sting you, they die. Okay, their stinger goes in, then they die. You want to get the stinger out because the stinger is what's carrying the poison, and hopefully you're not having you don't have a reaction to the. Now you will get a localized reaction if a bee comes and stings you. You'll get a localized reaction. Localized means it stays in that area. Okay, it's not spreading or going to your whole body. Systemic means it's going through your whole system. It gets in your blood, goes through your whole entire system, and gets your whole body. Okay. But like I said, when a bee stings you, if you're not allergic, you'll have a localized reaction. You might get some swelling. You might get some redness. You'll get some tenderness and some pain. All right. You'll want to get a credit card or something that has a smooth edge and try and slide it over to get the stinger out. Okay. Hey, Marsha, thank you so much. Good to see you. We went to college together. Big ups to ORU. All right. So, you want to get the stinger out, okay? So nice thing about bees, I don't know if it's nice, but when they sting you, they die. So they're only going to sting you once, okay? You will get a localized reaction, and just pray that it doesn't go systemic. If it does go systemic and you are allergic to bees, you need to be carrying your EpiPen, all right? Carry your EpiPen. If you are allergic to bees or insects, carry your EpiPen. You can go to an allergist, you can go to your family doc, you can go to your internal medicine doctor, and you can get tested for insect bites and allergens in your area where you live, and they can test to find out if you're allergic to anything. And that way you can know before something bad happens if you need to be carrying an EpiPen, all right? But like I have an allergy to bees. I remember one stung me when I was a little girl, stung me here on my neck, and I swelled up like a puffer fish, okay? So I should have an EpiPen. I need to go get a prescription. I need to go see my doctor and get a prescription. So you need to carry your EpiPen if you're allergic. Be prepared for the localized reaction if you get stung by a bee. Now, wasps, hornets, blackjacks, those all, yes, you do. Because I have an allergy to bees, I did have my son tested because allergens to bees and to bugs can be genetic. So we did go and have our son tested, and thankfully he is not allergic to bees. All right, and you can develop immunity to things that you were allergic to at one point, and then you can also develop an allergy later on in life. So if you have a reaction, you need to go see your doctor, yes, if you have a reaction, so that we can find out if you're allergic, to find out if you do need to be carrying an EpiPen in the future or not, okay? So wasps, yellow jackets, blackjack, I think they're, what are they called? Yellow jackets, wasps, those can sting multiple times, okay? So they'll sting you and sting again and sting again. They don't die, all right? So you really, if you get stung by a wasp or a yellow jacket, that can be a little bit more problematic because that can go systemic very quickly because they can sting you multiple times. So again, have on your bug spray, and also if you see them flying around, don't mess with them. Don't go in the area where they're at. Don't do anything to bother them. If you see them, call your exterminator, get their hives or their little nests knocked down. Yeah, ouch is for real. All right, so what else can bite you? So we got bees, we've talked about mosquitoes, we've talked about ants, fleas. So if you have, thank you Superior, if you have animals or pets, then they can have fleas. If they're outdoors, they can get fleas. They can bring the fleas inside. Fleas can bite you. Flea bites usually look like little red singular bites kind of up and down your legs. They can be up and down your arms. They really could be anywhere, but usually we see them arms and legs. You treat them kind of the same way. You want to cool them off, use a antihistamine, use a topical rub, and then you of course want to get your pets treated and make sure that they don't have the fleas, because then they can't bite you. Okay, you don't want to have your pets on your bed. I know a lot of dog owners and cat owners. Hey, Dr. DeQuisha, thanks for joining in. They let their animals sleep on the bed with them, but when you do that, you have run the risk of those fleas getting into your beds and getting into your bed sheets and your bed clothes, and then you can get bit by the fleas. Okay, so you want to treat the fleas, and then to treat your clothing, if they have fleas, if your animals have fleas, you want to treat your clothing. So washing your clothes in as hot a water as you can get with some color safe bleach. Color safe bleach, of course, so you don't bleach your clothes, but you want to have color safe bleach, hot water, and you want to wash your bed sheets, your towels, your clothes, everything, because you want to make sure you get rid of all the fleas. The heat actually kills the fleas, and then you don't have to worry about them. Also sometimes you have to get the exterminator to come and actually bomb your whole house, flea bomb your whole house to get rid of all. Hey there, Deetra, thanks for joining in. Good to see you. You want to get rid of all the fleas in the house, okay? What about bed bug bites? We're going to talk about that next too. So bed bugs, kind of the same way. If you go someplace, usually we see bed bugs in hotels, if you go to somebody else's house that has, or location that has bed bugs, then you can get bed bugs as well. Bed bugs typically occur also on the legs, the arms, and your back. Think about, it's going to be places where you're laying on your bed. That's where they're going to bite you. Bed bugs kind of look similar to the flea bites, only they're not, they tend to be a little bit more spread apart. The flea bites, you'll see like a whole bunch of them like on your legs. Bed bugs, typically, they're kind of a bit more spread out, okay? But if you get these bites, go in and see your doctor. That's like an urgent care visit. You want to go immediately to your doctor and find out what is biting you, what is biting me, all right? So how do you treat the bug bites? Same kind of way. You want to cool them down. You want to not scratch. You want to use your calamine, your aloe vera, your antihistamine, your Benadryl, your Zyrtec, Allegra, Claritin. You want to not scratch, and then you want to have your house treated for bed bugs if you have bed bugs. All right, so bed bugs, things that you need to get your house treated for: bed bugs, fleas, and those are the two main ones. Okay, so that brings me kind of to scabies. What are scabies? A lot of people have never heard of scabies. Scabies are little mites. They're disgusting looking, like the actual little mite. They're kind of scary looking. They have these like scaly little legs and ugh. So the scabies, they are transmitted in people's clothes. Scabies. So Superior, to answer your question, rubbing the bites instead of patting them are just as bad, or rubbing or patting is actually just as bad as scratching, because you are still irritating that area. So you want to try to not rub, don't pat it, because you're still making that localized reaction even worse. Now, I will tell you this, rubbing and patting is a little less problemsome than scratching, because when you scratch, you can get what's called a super infection, when, because we have nastiness underneath our nails. I need to go get a manicure, but you have carry nastiness underneath your nails. So when you scratch, you can infect the area where you're scratching. So you don't want to scratch. Hey, Dr. Lee, how are you? You don't want to pat either, because patting still causes that localized reaction and it's going to make it worse. Okay, so don't rub, don't pat, try and leave it alone. Get the cool pack or whatever you're going to put on, something cool to put on it. Get your topical rub to put on it. That's the best thing to do. Don't scratch, don't pat, don't rub. All right, let's go back to scabies. Scabies, these little mites with these little spindly legs that they come and they bite and then they burrow underneath the skin. You know what a burrow, like, so they're gonna try. Hey, Lachey, thanks for joining in. Good to see you. So they're gonna burrow underneath the skin. Now, where do we see scabies? We see scabies, so how do you get scabies, first of all? Scabies they attach to clothing. And so if you go and stay at somebody's house or at a hotel, or if somebody comes to your house and they have scabies on their clothes, they can leave scabies at your house, okay? Ugh. So how do we know scabies? Scabies oftentimes will bite on areas where we wear clothes. So you see scabies a lot of times in between the webs of your fingers, okay? In between the webs of the toes. They like to go up the legs, on the buttocks, also on the shoulders and arms. Hey there, Tara. Thanks for joining in, cousin. Good to see you. So that's where you'll see scabies. Scabies itch like the dickens. You see a lot of scabies a lot of times in places like dormitories when there's a lot of people and they're sharing one spot. You see scabies, like I said, when you go to visit somebody or if they come to visit you, they could bring the scabies because they attach onto your clothes. No more guests at my house. Well, you can bring your guests over. You just don't want them sitting in your private areas, you know, like your bedroom and things like that. Hey, Crystal, thanks for joining in. So scabies, you'll see not just one little bite like you would with ants or like you would with the fleas. Scabies burrow, and then you'll see like a group of bites. So there'll be a group of bites all along your hand in a row like this, okay? And scabies don't die with just the topical stuff, the calamine lotion and the antihistamines and the Burt's Bees, and that's not how scabies die. You actually have to have a prescription for a medication to kill off scabies. Yeah, it takes a prescription. So you have to go see your doctor. If you notice that you're getting itching in between the webs of your fingers, go see your doctor, because sometimes that can be scabies and they'd have to give you a prescription for a medication called permethrin. You have to kind of put it on from neck all the way down to the rest of your body, sleep in it overnight, and then we rinse it off the next morning. Sometimes that has to be repeated depending on how bad the scabies infestation is, okay? So scabies, kind of hey, Dr. Zarina, thanks for joining in. Scabies are kind of scary. So, and not a lot of people hear about, people can only come in naked. No problem, Superior. I'm sure people are not going to want to come in naked. All right, so we've talked about scabies. We've talked about ants. We've talked about fleas. We've talked about mosquitoes. We've talked about bees. Let's talk about ticks really quick. So ticks are the little insects that can, what kind of environment does who live in? Who, the scabies or the ticks? How can you treat someone? Can you treat babies? Yes, we can treat babies. Hey, Tina, thanks for joining in. You can treat babies if babies have scabies. Like I said, it's a topical. There are medications that you can take by mouth. Hey there, Malia, thanks for joining in. Scabies are everywhere. They can be anywhere. Like there's no, like we'll talk about ticks. You normally see areas for ticks. But scabies can be anywhere. Like anybody can carry scabies, the South, the North, any country, any place, unfortunately, because the scabies can attach to the clothes, and so people can bring it with them, all right? Hey, Melissa, thanks for joining in. How's that baby of yours? All right, so bed bugs. Oh, yeah, we talked about bed bugs. Bed bugs are nasty little buggers too, and we'll get back to that in a second. But let's go back to the tick. So the tick, we often see they're carried by, hey, Miss Cora, also known as Mom. Thanks for joining in. Well, Eni, you don't want to say no more thrift shopping. What you want to do is when you do go thrift store shopping, you want to wash those clothes before you put them on. The clothes, the towels, whatever you're buying at the thrift store, wash them in hot water with color safe bleach that kills off all the buggers. Okay, so you don't have to worry about them anymore. So Yeah, you can go thrift store shopping. I love a thrift store shop. I'm just not going to put it on until I wash it real good, okay? So ticks, they often attached to animals. So you'll see them like in the woods. You'll see them in places that have deer. You'll see them, even dogs can get ticks. And so if you are outdoors, if you're going to the woods, if you're going hunting, if you're going, hey, Felicia, thanks for joining in. I got you scared. Well, don't be scared. Just be informed and you know how to take care of them. Hey there, Miss Robinson, thanks for joining in. So the ticks. So the tick bites you, and after they bite, they burrow their head underneath your skin. So other things that bite, they kind of stay on top of the skin. When a tick bites you, it actually goes underneath the skin and it burrows under there to keep eating. I know that sounds totally gross, but that's what they do. So when you see something kind of inside of your skin with something big and kind of bulbous kind of hanging out, it just kind of depends on how long they've been there, for how big they get, because they're going to eat and they're going to fill up with blood. When you do see a tick, number one thing you want to do, don't squeeze the tick, because if you squeeze the base, the little body of the tick, you could actually squeeze more venom and more nastiness into your body. So don't squeeze a tick if you have a tick, okay? What you want to do is get a pair of tweezers. You want to take it, you want to pinch it as close to the skin as you can get it, because that's where the head is. You want to pinch and you want to pull straight, okay? Pinch, pull straight. You don't want to twist, because you'll twist the body off of the head and the head will still be in your skin. Ew. So pinch, pull straight. Don't pull at an angle, because then the head again can come off and then the head will still be in your body. All right. So you see the tick, pinch at the base, pull straight off. All right. If you can't get the tick off, go see your doctor. All right. They can get it off for you. All right. So when the ticks bite, the concern with us, most ticks, I'll tell you now, are harmless, other than the fact that they'll cause that localized reaction. But some ticks carry some really nasty diseases. Just like some mosquitoes carry nasty disease, some ticks carry nasty disease. So kind of depending on what area of the country you're in will kind of depend on the disease that the ticks can carry. So in the southeast, you see the ticks carry Rocky Mountain spotted fever. Hey, Dr. Luna, how are you? Rocky Mountain spotted fever is a tick-borne disease. Hey, Greg, thanks for joining in. Good to see you. Please share, everyone, so that everybody can learn about these nasty little buggers. All right, Rocky Mountain spotted fever, and then the other big one is Lyme's disease. Okay, I know everybody's heard of Lyme disease. Lyme disease is a tick-borne illness. So after the tick bites you, it can put you can get Lyme disease. There is a test for Lyme disease. I actually just tested somebody in my office this week for Lyme disease. When the tick bites you, if it is infected with the babiosis is what it's called. Hey, Miss Jane, thanks for joining in. Yes. We're going to learn so much today. So when the tick bites you, the babiosis, that's the name of the disease that causes the Lyme disease. When you get infected with that, you get fatigue, you get body aches, you get like a malaise. Malaise just means generalized sickness. You get headaches, you get you just don't feel good. Okay. Now the big thing about Lyme disease is that you get a very what's the word I'm looking for? A specific type of rash. We call it it almost looks like a bullseye. So if it's on your arm, there's like redness all around, and then there's a clear area, and then there's a big bullseye here in the middle. We call it a target lesion. So if you see redness in the middle, and then a clear area, and then more redness around the outside, go see your doctor, please. Okay, so that we can do some tests and make sure that you have not been bit by a tick with Lyme disease. Okay, so target lesion. We all know what a target lesion is now, right? So target in the middle, bullseye around the edge, go see your doctor immediately. Like I said, you have fatigue, you have nausea and vomiting, you have headache, you just feel icky, you can have a low-grade fever. It's almost like flu symptoms, but with that bullseye lesion, go see your doctor because that might be a tick, okay? The other things that we can do for ticks, if you know you're going to be in the woods, make sure that you're covered. Again, make sure that you're wearing long sleeves. Make sure that you have on your DEET. And then before you come inside, hang up your clothes that you had outdoors. Hang them up either outdoors or hang them up in your mud rooms or someplace else. Don't bring them inside until you've let them sit in the heat, or throw them in the dryer. If you throw them in the dryer for 15 minutes, the dryer actually kills off the ticks, okay? So ticks don't like heat. So put them in the dryer, hang them outside before you bring them inside. And then you want to actually look at your body. Look and make sure that you don't have any ticks on your arms, your legs, any place that was exposed. Also, if your kids are playing outside and they're playing in the woods or something, examine them as well. Because like I said, but the tick, the longer the tick stays attached, the more it fills up with blood, and then the nastier it gets, all right? So examine your body if you're outdoors in the woods. Examine your body when you come inside to make sure that there's no ticks attached, all right? Examine your kids too. Examine your animals too. Animals can also get ticks. And they can transmit the tick. They can bring the ticks in on them, and then the tick can bite you. All right. I think we've hit everything. Let me see. Let me just make sure on my list here. Ticks we talked about. We talked about bees, yellow jackets, and wasps. We talked about mosquitoes. We talked about fleas, ants, and scabies. I know, right? Ew. The only thing I didn't talk about was spiders. So spiders can bite. I know. The two main spiders that you need to be worried about: no dryer. Everyone must now enter my house naked or stay outside. You're funny, Superior. Spiders can bite you. Oftentimes, the two main spiders that we're worried about are brown recluse spiders and the black widow spiders. So the black widow spider is that big black spider, and it's got like a red or orange shaped hourglass on the bottom. It's got really spiny looking legs. They're huge most times. I know, Mom, it's gross. But when those bite you, they leave fang marks. They have fangs. They have two little fangs because they're little devils. And they bite you and they leave two little fang marks. They're probably not going to be that far apart. Two little fang marks. So if you see two little fang marks, then that could be the sign of a spider bite. A lot of times people say like, oh, I got a spider bite because they have an abscess. And I'll do a whole nother talk with the doc session on abscesses. But a spider bite can be painful sometimes. Sometimes it doesn't have to be painful. And a lot of times people don't see the spider when it bites them. So they just come in with a rash or with the with pain sometimes, and that localized problem. Now, the brown recluse, those can actually make you really, really sick. So you can actually get a systemic horrible reaction. You can get where the poison from the brown recluse can get into your body and make you very sick. Okay, it can cause necrosis, which means the tissues are actually dying from the inside out, and you do need to get a anti-venom medication for brown recluse spiders and also for black widow spiders. Okay, so I know that was a disgusting topic today, creepy crawly things. I hope I didn't scare anybody, but I just want you to be informed so that you know that there are insects here. In fact, if you ask me, I think insects, this is their world. We're just living in it. So we're here on their land, but we do have to know how to live with these insects and with these things that bite us, because they do bite and they do hurt. And I'm getting ready to go put my feet back up because my foot is still hurting from where that little ant bit me yesterday. I'll show you the today picture of how my foot looks today. So how it looked yesterday, swollen, nasty, ew. And how it looks today, swelling's gone down a little bit. Still very painful. You can see right here, the redness, that's where it bit me. But I'm still swollen. I could barely get shoes on today. Hey, Sandra, thanks for joining in. I couldn't even wear my heels today, y'all. You know, Dr. Diva loves to wear her heels. I couldn't even wear heels. I could barely get a shoe on, much less anything else. So I'm getting ready to go take some more Tylenol, put my feet back up, take probably another round of an antihistamine so that I can fight the rest of whatever this ant bite put into me. All right. I'd like to thank you all for joining in with me today and discussing the ant bites. The scabies, what else we talked about? Mosquito bites, tick bites, bee stings, spider bites, fleas. all the creepy crawly things that can turn beauty into a beast. All right. Thank you for joining in with me. I am Dr. Nicole, your board certified family physician. I help people manage and prevent chronic medical conditions, and I help to explain these conditions to everyday people in terms that you can understand, all right? Through my books, my programs, my concierge medical practice, I help pastors, congregations, and everyday people transform their lives and mind, body, and spirit so that they can have greater impact on their congregations, their children, their communities, and everyone around. I did cover bed bugs, Tara. Go back and look at the video again. I did cover bed bugs. They're nasty little buggers too. All right. Thank you so much for joining in. Please join me next Sunday, 3 p.m. Eastern Standard Time for our next Talk with the Doc session. And it's going to be a really good session next week. Next week, we're going to talk about what we were going to talk about today, sexually transmitted infections. All right. Please join me next week. I look forward. If you have any questions, leave them in the comments and I will respond to them. Thank you so much. Follow me on Facebook, everybody. www.facebook.com/Dr. Nicole D.O. That's DrNicoleDo. Thank you so much for joining in. Talk to you next week. Bye-bye.